Hello. So today I'm going to talk to you about coccidia, which is another type of parasite that we can find on our fecal exam in cats and dogs, but it is not a worm. It is an organism that's called a protozoan, so it's a little bit smaller than our typical worms that we're looking for on fecal exam. It's something that you're never going to see with the naked eye the adult version of. So with worms, when they come out, you can physically see the worm. With a coccidia, even the adult version is microscopic, so you're not going to see it with the naked eye. The most common time that we encounter coccidia is going to be with young cats that are having constant diarrhea issues, but you can see it in adults and whatnot if their immune system is a little bit compromised or if they get exposed to a large load of it. Like many other types of parasites, it does have a fecal oral transmission, which means to infect another animal, they have to encounter the feces of the first animal that is infectious. Coccidia is not something that's covered with our general dewormers. It does need a very specific medication to kill it. And in our very small compromised patients, it can cause death from diarrhea and dehydration. So if you have an animal that has chronic diarrhea issues, it is worth it to look and make sure that this little parasite is not there. Thankfully, like I said, we don't see it as much in adults. There are actually some coccidia species that are non-infectious in cats and dogs that we will sometimes see on our more in-depth fecal exams. I have seen some pops for some cow coccidias and rabbit coccidias and a couple of others that are non-infectious in animals. They're just passing through the GI tract. But our canine and feline coccidia is something that we can typically see. They're itty bitty bitty on fecal exams, but normally we can see them and diagnose them on in-house fecal exams of animals with diarrhea. Probably the most difficult thing is it's very easy for an animal to reinfect themselves with coccidia. And this is another issue we get with really young kittens. When young kittens have diarrhea, they want to groom themselves afterwards. They want to clean that off of themselves, and that's reinfecting themselves with the coccidia because they're in the poop and they're licking it. So they're getting it in that fecal oral transmission. So cleaning the environment is incredibly important when treating coccidia patients. 99% of the time when you have a persistent coccidia infection, it's really a reinfection because we're not keeping the environment or the animal clean enough.